My mom has been a CHA patient for over 15 years, and she received her care in Haitian Creole. Although I'm an interpreter by training, I always feel relieved when I'm not asked to interpret for her. And the reason for that is because some of the questions that they ask are of personal nature. Also the power dynamics and the fact that I think my mom complained too much. Given that my mom's state of mind is sharp, using me as an interpreter can really undermine her potential to be an active participant in her own healthcare.
Avlot, your personal experience with your mom is supported by research literature, which shows that communicating through an untrained interpreter, like a family member or friend, does compromise the quality of care and safety for patients who have limited English proficiency, which we refer to as LEP. And here at CHA, there's been a longstanding commitment to providing high-quality care to LEP patients. And as part of this commitment, Avlot's department, the Multicultural Affairs and Patient Services Department, has collaborated with the Institute for Community Health since 2012 on a quality improvement initiative that is aiming to reduce the usage of family and friends as interpreters during clinical encounters. Now, when we started this work a few years ago, Avlot, I'm sure you remember, we found that family and friends were being used to interpret quite frequently at some CHA sites. There were some locations where almost a quarter of LEP patient encounters were using this risky practice.
As a centralized QI team, we have implemented several new strategies, including policy changes, operational improvement within our interpreter team, and specific outreach to specific department.
We've been really happy with how things are looking as we've monitored data over time. Our latest data is showing that there are 11 sites now at the Alliance that are using family or friends to interpret more than 10% of the time, and this is down from 16 sites when we first started. We've also seen 2 sites, Assembly Square Orthopedics and Somerville Surgical Specialties, that have shown a really striking and sustained improvement. We had some conversations with the managers at those sites to try and understand the approaches that they're using, and we've identified some strategies related to patient communication and workflows that can really help support CHA's policy and also just make it easier to use professional interpreters as the first choice.
There is no question that trying to reduce the use of family and friends in interpretation can be challenging. However, we'll continue to work together. We'll share our findings CHA-wide, and we'll see if we can continue to make progress in that area.